1, 2. 1, 2, 3, 4. 1, 2, 3, 4. Hello, welcome back to the COVID Chronicles. For those of you that don't know me, my name is Jonathan Downham and I am an advanced critical care practitioner in Birmingham, in the Midlands, in the UK. This is a series that I've been doing and I haven't been here for a couple of weeks, so I apologise for that. Quite busy at work though. I think since last time I was on here, we have many more patients than we had before. We've taken over our theatre suite. And basically where we would normally have 11 ITU patients, we got closer to 30. So first thing I want to say, and this is a huge shout out to the non-critical care nurses who have been helping us. So they work in places like day case unit, and they've been fabulous. Some of them look a little bit scared and a little worried, but they've been brilliant. They've been really, really brilliant, and you know, without them, we would have really struggled. So I want to make a huge shout out to them, theatre nurses, ODPs, day case nurses, fabulous. So that's the first thing I want to say, and that's the most important thing I want to say. So the reason I'm posting these is so that I can talk about the various Twitter resources that I found. For those of you not on Twitter, you need to get on there. There's a lot of rubbish, but there's also a lot of great stuff. And I say this every time as well, that if you want to use Twitter effectively, you need to know what to follow rather than who to follow. So you would use a hashtag for that. And the hashtag at the moment is hashtag COVID-19 or hashtag COVID-19. Any of those will get you lots of resources. Once you find some of the medical tweets, then go follow them. And once you start following them, if they're regular tweeters, you'll get lots of useful information. Follow me if you like. I'm at CC Practitioner. I try to tweet and retweet a lot of the useful stuff. So without further ado, what have I seen on Twitter over the last few days? So let me just change the screen and get you onto here. So this is my Twitter feed, and let's start with the first one, which is by ICS Updates. ICS is the Intensive Care Society, who I've done a lot of work with in the past at their various conferences. I help produce some of their podcasts as well. We are putting out a series at the moment based on last year's conference in December, but also in between putting out lots of other useful stuff as well. So if you want to go to look at podcasts, and again, podcasts are a fabulous resource. Lots of medical podcasts out there which will help you. I have one myself, Critical Care Practitioner podcast. Hopefully later on today, I'm going to be chatting to Brendan McGrath, who is the national lead for the tracheostomy guidelines that are going to be produced for the COVID patients. So we're going to have a chat today for a podcast at about 4 o'clock today, and hopefully I'll get that podcast out in the next couple of days, and also we'll publish it for the Intensive Care Society. So basically, ICS Updates are launching a new webinar education program starting with Fusic lung ultrasound in the age of COVID-19. So that any of you who do lung ultrasound or are interested in ultrasound, there's going to be a webinar this afternoon. Let's just make sure I go to the right one. There we go. So the webinar from the ICS Fusic Committee will explore the use of lung ultrasound in critically care ill coronavirus patients. And we've got several people on there who all are ultrasound experts. So Nitin's going to be leading it. He's on the ICS Council and Digital Media lead. Does a lot of ultrasound himself. Adrian Wong, Johnny Wilkinson, Ben Atwood, Hannah Conway, and Prashant Paraluka. So it's a free webinar. It's this afternoon. If you can't make it this afternoon, then I believe that they're going to post it on their website post-webinar as well. It's obviously very visual, so it's not something we're going to release as a podcast because I don't think it would work as a podcast. So that's the ICS The next one I wanted to point out was a tweet by Continuous. Continuous is a company that runs live teaching sessions. Normally you would have to pay for them. These are free. And the one that caught my eye is a free lecture from psychologist Dr. James Jackson from the US on post-intensive care syndrome during the pandemic. And that again is this afternoon, but again, I'm assuming it's going to be recorded. So if you go to their website, and all the links I'm going to put in this post. So if you want to go and look at these, you can just follow the links. And this would be post-intensive care syndrome in the era of COVID-19. Now, post-intensive care syndrome is something that our patients suffer from anyway, and we've got a lot more of them. So, you know, the early stages and even the middle stages are not necessarily the most important. Getting these patients over the post-intensive care syndrome is also something that we are going to have to do in the long term. If you don't know what post-intensive care syndrome is, then I'm assuming this lecture will tell you. I'm not going to go into it now, but basically it's kind of the long-term effects of being in intensive care. So that was that one that caught my eye. The next one was a tweet by Simon Carley. Simon is a consultant in emergency medicine up in Manchester, and he highlighted a weekly COVID-19 online journal club for emergency medicine and critical care. Now, I know this, again, is this afternoon, and I know it's full. You can see here this webinar is already at capacity. So it is full, but I did see a follow-up tweet about this, somebody saying it was full, and they're saying that they're going to post them on the Royal College of Emergency Medicine website once the webinar has happened. So you won't be able to watch it live, you're too late, but you will be able to watch it post-event. So I'm sure that will be extremely, extremely valuable. I'll come back to this one because I like this one, but that's for the end. And then the other one I want to give a big shout out to is by SunnyDoc72. Now, this is an Australian chap who runs something called Osler. Now, Osler is something that he is setting up, trying to get people to be able to record their skills and get those validated by other people and use that as a transferable record. Been doing this for some time now, but basically these are free resources by Osler. So if I open the page here, this is Osler, and this is the Osler's COVID-19 Learning Centre. So there's lots of resources on here. For instance, we've got a podcast, David Brewster, Intubation for COVID-19. They do have a podcast as well, I'm sure. So if you can go and find their podcast, there's lots of useful resources in here. But these particularly caught my eye. So this we're covering here. Recent released high-flow nasal oxygen therapy, personal protective equipment, assisting intubation, endotracheal tubes, prone ventilation, and initial assessment of the critically ill patient. And, you know, we just move down. There's lots and lots and lots of resources here, and they're all free. So thank you very much to Osler for making them free. The one on prone ventilation I haven't watched yet, but I'm going to. It's about positioning in care, which a lot of the non-critical care nurses and even the critical care nurses who are not so familiar with it will find extremely valuable, I'm absolutely sure. So that's another one. And again, the link is down below. And then the last one I wanted to show you was this one, because I just like this one. I thought this was quite funny. So this is by Cara Thompson, and Cara Thompson is an anaesthetist in Dunedin, New Zealand, and relative importance in 2020 to date. So you can see the of less relative importance now. The car is skedaddled its way down, as has shaving. Well, not if you work in ITU, I'm afraid you have to shave even more, but perhaps if you're staying at home, shaving is less important. The relative importance of the internet has gone up, obviously. Alcohol seems to have shot up as well. Flour, yeah, we can't get any flour. I tried to go and buy flour yesterday. Shelves were bare still. I don't know what everyone's doing with all this flour. I presume there's lots of children making cakes for their parents to eat. I just thought that was quite funny. And bras, it seems to have plummeted down to the bottom. So presumably there's a lot of women at home who aren't going to work who have just dispensed with the need for a bra. So actually, I just thought that was quite funny. So a light-hearted note to finish with. I hope these are useful. I hope there's resources that you can use. I'm going to keep looking out for them. I am on nights for the next 2 days. I hate nights, but hey, it's part of my job. I've got to do it. I wait to see what's happened. I know we're probably just as busy as we were when I left a couple of days ago. So there's more yet to come. Let's see what happens. And I hope you stay safe and everyone takes care of themselves. So speak again soon.